Good morning, everyone. Today's lecture is about antimicrobial drugs. What is the antimicrobial? An antimicrobial is a drug which is used to treat infectious disease caused by microorganisms like bacteria, viruses, chlamydia, etc. It targets microbial vital enzymatic processes causing either killing of the microbe وما يسمى بهالحالة سايدل effect يعني يقتل الميكروب or inhibiting its growth static effect يوقف the growth of the microbe. فهذه المصطلحات you should be aware of. Classification of antimicrobials. In this diagram you can see the classification of antimicrobials are two major groups اللي هي الانتيسبتكس والانتي انفكتيفز. هناك بعض الفروقات ما بين الانتيسبتكس والانتي انفكتيفز اللي هي موضحة أكثر في هذا السلايد. الانتي سبتك كما مذكور هنا في هذا السلايد هو a chemical that kills or inhibits growth of microorganisms. It is applied to skin or living tissue. بينما الانتي بايوتيك بالمناسبة هو مثال من الانتي انفكتيفز. الانتي انفكتيفز المذكورة بالسلايد السابق مثال عليها الانتي بايوتيك فإت follows the same rule. Antibiotic is a natural or synthetic drug given to prevent infections or to kill or inhibit bacteria in a living host. In a living host هذا يعني يقتل البكتيريا أو الجرثومة داخل الهوست. الانتيسبتيك هو عادة فد شيء يعطى بشكل خارجي على السكين or on living tissue مثلا قد يكون معقم مطهر مثلا الكحول أو السبيريت أو البوفيدون أيودين. زين عندنا شيء آخر تعريف آخر disinfectant is a chemical that kills or inactivates or inhibits growth of microorganisms on inanimate surfaces. يعني inanimate يقصد بها الجمادات على الأسطح غير الحية ما لها علاقة بال living organisms. So مثال عليها هذه مثلا هاي المطهرات اللي تستعمل في الحمامات في غسل أو تنظيف أدوات الطبخ مثلا أو أدوات الجراحية أو في تعقيم المستشفيات يعني كلها تدرج تحت عنوان الديسانفكتنت. بعد عندنا شيء اسمه البريزرفاتيف. شنو البريزرفاتيف؟ is a chemical that prevents the growth of microorganisms that can cause product deterioration. product deterioration يقصد بها يعني خاصة المواد الغذائية. preservative هو مواد حافظة توضع مع المواد الغذائية مثلا في المعلبات أو في المواد تكون داخل مثلا حافظة مثلا نايلون أو بلاستيك اللي مجرد حفظ المادة الغذائية من التعفن والتلف. زين هسه شفنا هاي المصطلحات. هسه نرجع إلى هذا الدايجرام. قلنا الأنتي مايكروبيالز تقسم إلى أنتيسبتكس. عرفنا شيء أنتيسبتكس والأنتي انفكتيفز والمثال عليها الواضح هو الأنتي بايوتيك. الأنتي انفكتيفز تقسم إلى شنو؟ عندنا الانتيميكروبيالز سوري antibacterials التي أيضا تسمى antibiotics. وكذلك عندنا الانتي فايرالز اللي هي تقتل الفيروسات أو تمنع تكاثرها. انتي فانجلز تقتل الفنجاي الفطريات. الانتي بروتوزوز والانتي هيميتكس هذين تقتل المواد اللي تقتل الطفيليات أو الديدان. هسه نجي للclassification of antibacterials according to mechanisms of action. عندنا أول جروب وأهم جروب هي cell wall inhibitors. cell wall inhibitors يعني many drugs work on cell wall inhibition for the bacteria. أهم جروب هي البيتا لاكتام antibiotics. البيتا لاكتام antibiotics ليش سموه بيتا لاكتام؟ لأنه بالستركتشر ماله أكو شيء اسمه بيتا لاكتام ring. It has beta lactam ring and thus it's called beta lactam antibiotics اللي هي تقسم إلى penicillins, cephalosporins, carbapenems and monobactams. والcephalosporins أيضا it is divided into or categorized into first, second, third, fourth and fifth generation. وبعد لحد الآن لا زالت تطلع new generations. وأكو أيضا other antibiotics هي متابعة للبيتا لاكتام. They don't belong to the beta lactam antibiotics group. ومع ذلك in spite of this they work on cell wall inhibition. المثال عليه هنا هو الباستراسين والفانكومايسين. beta-lactam antibiotics. All beta-lactam antibiotics are bactericidal drugs. We have said before, bactericidal means it kills the bacteria versus يعني static اللي هي doesn't kill it, only stops the growth of bacteria or proliferation. فبالنسبة للبيتا لاكتامز all of them are bactericidal. The active part is the beta lactam ring. They inhibit building of a cell wall by interference with penicillin binding proteins, abbreviated as PBPs or transpeptidase that synthesize peptidoglycan. And thus, when it inhibits the building of the cell wall, it leads to less stable cell wall, and therefore it causes cell lysis. This slide shows the chemical structure of penicillins, cephalosporins, carbapenems. You can notice that in these three groups of antibiotics, you have bicyclic structure. يعني you have two rings. You have two rings in this structure. Only in monobactams you have only one ring, and thus it's called monobactams, single ring. This slide shows the mechanism of action of beta lactams. The figure above shows the structure of the bacterial cell wall. The bacterial cell wall, there is an important ingredient in the bacterial cell wall here, PBP, and there is an enzyme that is responsible for building these cell wall blocks اللي هو اسمه transpeptidase. what happens is that beta-lactams bind to transpeptidase active site, and thus transpeptidase will be blocked, leading to interruption in cross-linking and cell wall synthesis. The cross-linking is important to build a strong cell wall, and without cross-linking, the cell wall will be weak and leads to cell lysis. But many bacteria nowadays have developed resistance to beta-lactams. What are the mechanisms of beta-lactams resistance that are developed by bacteria? Either it is inactivation of beta-lactams by beta-lactamases. These bacteria that are resistant to beta-lactams have developed enzymes that can inactivate beta-lactam. These enzymes are called beta-lactamase. And nowadays, there are many beta-lactamases which are identified. The second mechanism is alteration in target proteins, PBPs. So there is no site for a drug to act. يعني chemical structure مع PBPs is changed. فما يقدر الدراج يتحد مع هاي PBPs أو يعني and can act as a blocker for the cell wall synthesis. مثال عليها الميثيسيلين resistant staphylococcal. They have made an alteration in target proteins. الاحتمال الثالث هي permeability barrier. The bacteria has developed a mechanism to prevent the entry of a drug to bacterial cell. The fourth mechanism are pumps and المضخات. Gram-negative bacteria can express transporters that function as efflux pumps to transport beta-lactam antibiotics out. They have developed some kind of mechanism to push or move the beta-lactams out of the cell. كأنما نوع من الضخ حتى يطلع الدرug outside the cell. What are the pharmacokinetics of beta-lactams? Most beta-lactam antibiotics are excreted through kidneys, but exceptions do exist, like oxacillin or cephalosporin or ceftriaxone. These drugs are excreted through the liver. What are adverse effects? The main adverse effect is hypersensitivity, تحسس. The most important, it can cause rash, urticaria, or angioedema. Second, diarrhea, إسهال يسوي, common and caused by effect on intestinal flora. You know, I think you have been taught this in the microbiology that that antibiotics affect the intestinal flora and make great disturbance in the intestinal flora, and thus would result in diarrhea. In some cases, pseudomembranous colitis may occur, or candidiasis. Pseudomembranous colitis here a serious complication or adverse effect that results from antibiotics usage that lead to destruction of the intestinal mucosa, so damage اللي هو induced by these bacteria صار بها disturbance of يعني فيصير damage للintestinal mucosa and causes severe diarrhea. فطبعا this is a serious adverse effect. candidiasis يعني يصير نمو للفطريات. nephritis, neurotoxicity, seizures with high dose of penicillin. ممكن تحصل with high dose of penicillin نوبات صرع. leukopenia and thrombocytopenia. Another adverse effect is rash that occurs with infectious mononucleosis infection. This is a kind of viral disease, infectious mononucleosis, that is caused by EBV, Epstein-Barr virus. Infectious mononucleosis causes a faint, transient, generalized non-itchy rash, which lasts for about a week. It is described as maculopapular exanthema. It's often missed by the patient and physicians. It's a common infection خاصة بالأطفال أو التين ايج يسوي فد راش خفيف ويروح بسرعة وحتى sometimes هو البيشنت يعني not aware. لذلك الفيزيشنز يعبر عليهم هذا يعني يكون كلش خفيف not itchy يعني ما حد ينتبه له. المشكلة وين تحصل؟ when the patient has infectious mononucleosis and you give this patient a beta lactam. عادة هو شنو الكومن برزنتيشن انه يجي الطفل للعيادة عنده فد نوع من الراش خفيف ويمكن عنده مثلا تونسلايتس، فالطبيب يجولي يكتب له مثلا يكتب له اموكسي فاللي راح يحصل intense itchy maculopapular rash which appears on 7 to 10 days after treatment with beta lactam in active infectious mononucleosis infection. يعني الناس اللي عندهم هذا الفيروس وبعد اكتف ولا زال الراش موجود تعطيه البيتا لاكتام فيحصل عنده هذا severe intense itchy maculopapular rash. This is a kind of hypersensitivity reaction induced by the virus to the antibiotic. يصير تحسس that is induced by the virus. تحسس للبيتا لاكتام that is induced by the virus. It is not a true allergy and does not occur again if the antibiotic is given later on in the absence of EBV infection. يعني هي هاي فد مشكلة تسوي انه دائما البيشنت يقول انا عندي حساسية مال amoxicillin او ampicillin. هو اللي صار انه حصلت مرة واحدة لانه هو كان عنده infectious mononucleosis. ويعني it's not a true allergy وما تصير مرة ثانية يعني فرضا لو اجاك مرة ثانية ورا سنة طبعا infectious mononucleosis بعد راح وانتهى يقول لك ها أنا يعني عندي حساسية. لا هي مو هالشكل، هي ما ممكن تحصل مرة ثانية in the absence of EBV infection. So you can give amoxicillin يعني second time, and most of patients who say that they are sensitive to beta lactams في الحقيقة هم they are not sensitive. Contraindications of beta lactam antibiotics. As we said before, hypersensitivity is important and serious side effects. لكن المشكلة إنه how can you prove it? Or how can you predict it? As we said before, إنه many patients they think they are hypersensitive بالحسنون بالحقيقة not sensitive. طبعا هذا راح يحرمهم من الاستفادة من البيتا لاكتامز as a first choice drug for many bacterial infections. So as we said قلنا إذا هو يعني فعلا proved to be hypersensitive, okay, don't give. beta-lactam for this patient. لا طبعا هذا الموضوع موضوع واسع جدا. هل هي sensitivity is a specific or generalized for all beta-lactams? Is it a specific only for amoxicillin or only for penicillin or ceftiraxone or cefotaxime, or it is generalized for all of them? Is it specific for penicillins or it is generalized to include even cephalosporins? فأكو شيء اسمه cross allergy. cross allergy يعني شنو معناها؟ إنه if a patient has a sensitivity to a drug, it may have a sensitivity for another drug that have similar structure. زين. نطبق هذه المسألة على البنسلينز والسيفالوسبورينز. يعني اكو تشابه بالستركتشر كبير باعتبارهم اثنيناتهم they are under the beta lactam group. It is possible to find cross allergy between penicillins and cephalosporins, but it is not frequent. The risk was estimated to be 5 to 10%. احتمالية وجود هذا كروس الرجي انه مثلا واحد عنده حساسيه اموكسيل ممكن تعطيه سيفتيلاكزون وهم يصير عنده حساسيه، هذا الاحتمال ضعيف. It's about 5 to 10%. زين. لكن اكو اشياء مهمه يعني you should keep in mind when you deal with a patient who claims to be hypersensitive، يدعي انه هو hypersensitive. مثلا يعني you should ask about the history of anaphylactic shock. صار عندك يعني يسموها يعني الصدمة نتيجة التحسس، يعني يصير عندهم hypotension collapse rash وangioedema. اي اوكي بهالحالة this is important to check for and ask about history taking, and if you find this patient has a history of anaphylactic shock to penicillin for example, don't give cephalosporin, and vice versa. يعني العكس بالعكس، يعني إذا هو عنده مثلا history of anaphylactic shock to cephalosporins, don't give penicillin. طبعا هم most of them اللي هم يجوك للعيادة they never say anything about anaphylactic shock. They don't have any history of anaphylactic shock. هو كل اللي يشكي منها والله شوية جسمي طقع، صار بي راش وشوية عندي حكة. يعني this is could be a sign of allergy, but it's not a serious sign. So sometimes I may take the risk and give penicillin or cephalosporin, but I advise the patient to يعني to keep attention and to be alert for any signs of allergy. And if the patient develops any signs of allergy, he should go to the emergency immediately, to the emergency ward in the hospital immediately to deal with his problem. فهاي باختصار يعني باختصار شديد how can we deal with hypersensitive patient to a drug or antibiotic. Now we come to the classification of penicillins according to antibacterial spectrum. And, first of all, natural penicillins اللي هي they were derived from penicillium mold. هو أول ما اكتشفها منه كان Alexander Fleming, who noticed that penicillium mold has an antibacterial effect, and thus these penicillins they were derived from this mold. من هذا الفطر هو they were called natural penicillins. مثال عليه البنسلين جي، وله اسمه بنزال penicillin أحيانا، أو أحيانا يسمى crystalline penicillin. They are all the same. They are effective against some gram-positive bacteria like streptococcal pneumoniae, streptococcal pyogenes, some gram-negative cocci, Neisseria gonorrhea اللي هي يعني نتيجة يعني illegal sex contact, or Neisseria meningitis. Neisseria meningitis and Neisseria gonorrhea are closely related. Gram-positive bacilli like Bacillus emphasis and spirochetes اللي هي مثال عليه Treponema pallidum that causes the syphilis disease, kind of STD, sexually transmitted disease. Actinomycosis, it's a kind of anaerobic bacteria. But penicillin G is susceptible to inactivation by resistant bacterial enzyme, as we said before. It's a kind of beta-lactamase, and specifically it's called penicillinase, and less stable against gastric acid. So given parenterally only. penicillin G موجود على شكل حقن فقط، ما موجود على شكل كبسول أو tablet. يعني it is only given parenterally because it is sensitive for gastric acid. And half-life is short, less than 2 hours, and excreted by the kidney only and given IV, as we said before. Penicillin is given with probenecid. I think you remember this drug from the previous year. Probenecid, the drug that can prolong the half-life of penicillin. It inhibits the excretion of penicillin by the kidney, and thus it prolongs the half-life of penicillin, and so that single dose of penicillin could be given in case of gonorrhea. Procaine penicillin, it contains procaine. Procaine is a local anesthetic that is mixed with penicillin, so it can be given IM only. IM only. And IV, if you give IV, this will lead to thromboembolism. This is a serious complication. It acts more slowly and is a longer acting. It's used in less severe infections and given every 12 to 24 hours. And it has the same indications as penicillin G. بنزاثين penicillin G. هذه ما تسمى بالأوبرا الشهرية إن صح التعبير بالصيدليات. أوبرا penicillin الشهرية is very slowly absorbed following deep intramuscular injection and provides low levels in blood. It's used in treatment of infections caused by highly susceptible organisms such as Streptococcus pyogenes and Treponema pallidum. عادة اكو بعض الأطفال يصير لهم يعني chronic tonsillitis، السنة كلها يشكي إنه عنده sore throat or inflamed tonsil, and thus this is a candidate, and we should consider giving benzathine penicillin G, which a single injection can last for 3 to 4 weeks. ممكن يشتغل الدواء for 3 to 4 weeks. بذلك تقلل استخدام الحقن اليومية إن صح التعبير للtonsillitis that's caused by Streptococcus pyogenes. أيضا بالنسبة للsyphilis, Treponema pallidum, sometimes it's better to give the benzathine penicillin G أو ما يسمى بالإبرة الشهرية. It is used for susceptible organisms that require long course of treatment. Typical example, as we said before, is child suffering from recurrent tonsillitis. Here, benzathine penicillin is indicated. Another drug is penicillin V, أو ما يسمى بالphenoxymethyl penicillin. It has the same spectrum of penicillin G, but it is given orally. هاي يعني نقطة مهمة جدا عن الفرق ما بين البنسلين V أو البنسلين G. It has a short half-life, so it should be given 4 to 6 times daily. Now we come to a second group, which is the antistaphylococcal penicillins. It includes methicillin. Methicillin هسه هو nowadays is withdrawn، يعني انسحب من السوق لأنه صار عليه resistance قوية، فيعني it's not used anymore. بعد اكو other examples اللي هي الاوكساسيلين والكلوكساسيلين، فلوكلوكساسيلين والنافسيلين. They are called penicillinase resistant penicillins. هذني يعني they can work against the penicillinase enzyme. يعني ممكن يعني they can overcome، يتغلبون على الإفكت مع penicillinase enzyme for resistant bacteria. Their use is restricted to penicillin resistant staphylococci. Staphylococci and if it is penicillin resistant طبعا هي هسه mostly هي تقريبا أكثر staphylococci cases nowadays they are penicillin resistant. So يعني you should think or consider using antistaphylococcal penicillins. They may be combined with other penicillins to give stronger effect. مثال عليه الاكو الامبيسيلين والفلوكساسيلين. اكو كبسولة اسمها امبيكلوكس موجودة بالصيدليات، هذه تكون يعني wide spectrum and has stronger effect than fluoxetine alone. But some bacteria, especially nosocomial hospital-acquired infections, are resistant to these drugs and are called methicillin-resistant Staph aureus, MRSA or MRSA. الهوسبيتال أو nosocomial infections عادة تكون serious infections. البكتيريا الموجودة بالمستشفيات هي أصلا هي جاية من patients that are chronic that have chronic disease مستعملين antibiotics for a long time، فبالنتيجة البكتيريا اللي موجودة بأجسامهم تكون يعني عندها فد exposure to many antibiotics and they have developed resistance to many antibiotics, and thus nosocomial infections are usually serious infections. يعني إذا واحد يروح المستشفى يحصل له عدوى جرثومية يعني this is usually serious، خاصة إذا كانت مناعته ضعيفة. فلذلك لاحظوا أنه يعني mostly these kind of bacteria are resistant to these drugs. وضعوا مصطلح اللي هي methicillin resistant Staph aureus. عندنا أيضا ملاحظة مهمة على فلوكلوكساسيلين اللي هو may cause sometimes cholestatic jaundice. Now we come to the extended spectrum penicillins اللي هي البنأمبيسيلين والأموكسيسيلين. They are more effective against gram-negative bacilli مثال على الإيكولاي والأتش إنفلونزي البورتيوس ميرابيلس السالمونيلا تايفي ستريبتوكوكس فيكاليس. Usually these bacteria they are causing many GIT problems usually. So they are, as we said, you know, they are more effective against gram-negative bacteria in addition to activity on gram-positive microbes mentioned with penicillin. They are more effective in urinary tracts and upper respiratory tract infections. bacterial resistance is common. There are some differences between ampicillin and amoxicillin. Amoxicillin has longer half-life, so given 3 times daily, while ampicillin given 4 times daily. Ampicillin is less absorbed from GIT, so may cause more diarrhea. Why? Because it interferes with the growth of gut flora. But ampicillin is more effective against shigellosis. فهي أيضا مسألة مهمة. If you have shigellary infection, ampicillin is a better choice than amoxicillin. Now we come to the topic, beta-lactamase inhibitors. What are these? These are agents that inhibit beta-lactamase of bacteria. Beta-lactamase اللي قلنا عليه هو mechanism of resistance for the bacteria. شافوا اكو some agents that can inhibit this enzyme اللي هي الكلافيلانيك acid والمونوباكتام والتازوباكتام. These are processed by beta-lactamases to form an initial covalent intermediate. The inhibitors act as a suicide substrate which ultimately leads to the degradation of beta-lactamase. شنو يعني suicide substrate؟ هو يعني these agents will be taken by beta-lactamase. Beta-lactamase يعني يتعامل وياها كما يتعامل مع البيتا-لاكتام as a drug، كما يتعامل مع البنسلين. فيجي البيتا-لاكتاميز على الكلافيلانيك اسيد، يعني يريد يسوي له inhibition، اللي يحصل انه الكلافيلانيك اسيد it acts like a suicide، انتحاري، suicide inhibitor، انتحاري، يعني هو يضحي بنفسه حتى it keeps or saves the penicillin or beta-lactam drug from being deactivated، وبذلك يفسح الطريق للبيتا-لاكتام حتى يشتغل على البكتيريا ويقتلها. And the inhibitors act as suicide substrate which ultimately leads to the degradation of beta-lactamase. Their role is to protect the beta-lactam ring of the active antimicrobial drug which is given in combination. It is kind of suicide inhibition، يعني يضحي بنفسه حتى ينقذ الدرج الأصلي أو الأساسي. مثال عليه الأموكسيلين والكلافيلانيك أسيد يسموه أوغمنتين. أوغمنتين هذا الموجود في الصيدليات بيحتوي على الكلافيلانيك أسيد، بهالطريقة يعني يكون more powerful than usual amoxicillin. أيضا المثال الثاني بيبراسيلين it is in combination with tazobactam to form tazocin. أيضا the same mechanism. بعد عندنا الانتي سودومونال penicillins. Pseudomonas aeruginosa is a serious pathogen and it may cause many diseases that are life-threatening. لذلك اهتموا بها الشركات الأدوية وسووا antibiotics that are targeting Pseudomonas specifically. مثال عليها الكاربنسلين والتيكارسلين والبيبراسلين. So they are called because of their activity against Pseudomonas aeruginosa and Proteus species. مو بس على يشتغل على Pseudomonas، يشتغل على Proteus. طبعا هي البروتيوس هم يسوي serious infections. أيضا these are inactivated by beta-lactamase. They were combined with suicide inhibitor. Nowadays, piperacillin is the most potent and they are given IV. طبعا هنا as we said it is anti-pseudomonal، يعني هنا يشتغل على pseudomonas أو البروتيوس، بس هذا مو معناه أنه ما نقدر نستعملها for other bacteria، يعني مثلا إيكولاي أو سالمونيلا، بس it is يعني يعني not a traditional way or usual way of using these drugs. they are saved، محتفظين بها للشدات على قولتهم نستعملها for Pseudomonas aeruginosa and Protea species. They are not used routinely for everyday infection with usual microorganisms. Now we come to the second group, beta-lactams, اللي هي cephalosporins. Beta-lactam antibiotics, they are beta-lactam antimicrobials that are closely related to penicillin structurally and functionally and have the same mechanism of action of penicillins, but they are more penicillinase resistant. هنا من ناحية الباور against resistant organisms or microorganisms, they are more powerful. Cephalosporins are ineffective against MRSA. First, as we said before in the first two slides, there are many generations of cephalosporins. The first generation has better activity against gram-positive bacteria, while second and third generations are more active against gram-negative bacteria. Only third generation can cross blood-brain barrier. Now we come to the classification of cephalosporins. The first generation مثال عليه cephaloxine, cephaloxine and cephaloxine are given orally. Cefazolin has longer duration and given parenterally. All are effective against upper respiratory tract infection, tonsillitis, urinary tract infection, and minor skin infections, خاصة الستاف. Cephaloxine is a good choice for staph aureus because of their effect on gram-positive cocci and gram-negative rods. Second generation الأمثلة اللي عليه هي cephaloxime given parenterally and has long duration and can cross blood-brain barrier, while cefoxitin is given parenterally and it's effective against anaerobes. Cefaclor given orally. This group shows greater activity against gram-negative rods, but less activity against gram-positive cocci than first-generation agents. Third generation, it means cefotaxime, الكلافوران, السيفكزين given orally. والسيفترياكزون أيضا مشهور هذا longest duration given once daily. Have a good option, and you should consider when you want to give as less as possible of injections. You should give ceftriaxone. It's given once daily. Good for renal failure patients. Ceftriaxone is active against Pseudomonas aeruginosa. It has a broader spectrum than previous groups. The third generation has broader spectrum than previous groups, especially against gram-negative bacteria. Used clinically in many indications like upper and lower respiratory tract infections, like in penicillin-resistant pneumococci, urinary tract infections, especially in resistant cases, gonorrhea, genital, oral, and pharyngeal meningitis, and serious infections like septicemia and peritonitis. Fourth generation includes cefepime, given parenterally and can cross blood-brain barrier, has wide antimicrobial spectrum for both gram-positive and negative rods and cocci, and more resistant against beta-lactamase, so is used in resistant bacteria like streptococci. The fifth generation includes ceftobiprole and ceftolozane. Ceftobiprole has powerful anti-pseudomonal characteristics, and ceftolozane is a new option for treatment of complicated intra-abdominal infections and complicated urinary tract infections. What are the adverse effects of cephalosporins? They are similar to penicillins. Now we come to the carbapenems. They include imipenem and meropenem. They have broad spectrum effect for gram-positive, gram-negative cocci, Negative bacilli and anaerobes, including Clostridium difficile. Clostridium difficile is a microbe that's implicated in the pathogenesis of Pseudomonas colitis. It's a drug of choice for treatment of Pseudomonas colitis. It can cross blood-brain barrier when inflamed. بعض الدراجز تعبر blood-brain barrier easily at all times. Some drugs can cross blood-brain barrier only when there is an inflammation and meningitis. There are only two drugs. And some drugs they cannot cross blood-brain barrier. So you should think thoroughly before you decide to give an antibiotic for meningitis. You should check that this antibiotic is suitable for case of meningitis and can cross blood-brain barrier. Monobactams in groups group of drugs اللي بالحقيقة هي ما بها بس الاستريونام يعني كمثال عليها لحد الآن only الاستريونام اللي هو as you said before that has a single ring in the structure. It's effective for gram-negative bacteria like H. influenza and Neisseria gonorrhea, penicillinase producers, E. coli, Klebsiella, Proteus, and Pseudomonas. Ineffective against gram-positive and anaerobic organisms and suitable for penicillin allergic patients. Vancomycin can be given IV or orally. It's a cell wall inhibitor but not containing beta-lactam. It's effective against multiple drug-resistant bacteria such as gram-positive cocci, including MRSA, anaerobic species including Clostridium difficile, and can cross blood-brain barrier when inflamed. Indications in Pseudomonas colitis, beta-lactamase positive organisms, and allergic patients to penicillin, and acts synergistically with aminoglycosides and used for patients with enterococcal endocarditis. Endocarditis is an inflammation of the endocardium or the يعني البطانة مال القلب غشاء اللي يغلف القلب من الداخل. It's called endocarditis. What are the side effects of vancomycin? Causes fever and chills, red man syndrome on rapid infusion, as you can see in this image. احمرار في الجسم, shock due to histamine release, and sometimes ototoxicity. And thank you for your listening. And if you have any questions, you can ask by submitting your questions on the classroom chat, or you can send me an email. And don't forget to check your presence on the attendance Google form for this lecture. And thank you again for your listening.